Xanax. Your heart is pounding, hands feel shaky, and your brain won't stop racing. Then about 20 minutes later, everything starts slowing down. Your body relaxes, your thoughts stop sprinting. The panic begins to fade. That's the effect Xanax produces. Xanax, or alprazolam, is a benzodiazepine, a drug designed to slow activity in the nervous system. As the drug takes effect, the brain sends fewer stress signals. The feeling of alarm drops. Your body stops acting like it's in danger. For someone in the middle of a panic attack, that relief can feel almost immediate. But Xanax slows more than just anxiety. Thinking becomes foggy. Coordination weakens. Reaction time drops. At higher doses, people may slur words, struggle to stay awake, or lose memory of what happened. The brain also adapts quickly to the drug. After a while, the same pill produces less effect, which pushes people to take it more often or increase the dose. As tolerance builds, the brain can start depending on the drug to keep panic from coming back. OxyContin. The pain finally lets up. The sharp ache dulls, your body loosens, and the part of your brain screaming about the injury goes quiet. That relief is what OxyContin is designed to do. OxyContin contains oxycodone, a prescription opioid used to treat severe pain. Normally, when something is injured, nerves send pain signals up the spine to the brain. OxyContin turns that signal down. Pain feels weaker and the constant urge to protect the injury starts fading. But opioids also slow the body down. Breathing becomes slower. Pupils shrink. Your body feels heavy and drowsy. At higher doses, breathing can slow so much that the lungs stop getting the signal to breathe. When the pain fades and the body relaxes, the brain releases dopamine. That chemical marks the moment as something worth repeating. OxyContin was designed as a slow-release tablet that spreads the drug into the bloodstream over many hours. But if the pill is crushed or chewed, that control disappears. The full dose reaches the brain all at once, creating a stronger high and pushing tolerance to build much faster. Fentanyl. The amount needed to produce an effect can be almost invisible. Just a few grains, sometimes less. Yet that tiny amount can be powerful enough to shut down the body's breathing system. That drug is fentanyl. Fentanyl is a synthetic opioid used to treat extreme pain, often after major surgery or during late-stage illness. It reduces pain by strongly suppressing the signals that travel from injured tissue to the brain. When fentanyl enters the bloodstream, pain signals weaken quickly. The brain receives fewer distress signals and the sensation of pain drops sharply. But fentanyl also depresses the central nervous system. Breathing slows. Oxygen intake drops. Carbon dioxide begins building in the blood. Heart rate can fall and alertness quickly fades. Because fentanyl is extremely potent, doctors measure doses in micrograms, amounts so small they are barely visible. That potency creates a dangerous margin. A dose only slightly higher than intended can slow breathing to the point where the lungs stop receiving the signal to breathe. When that happens, oxygen levels fall rapidly and the brain and vital organs begin shutting down. This combination of extreme potency and respiratory suppression is what makes fentanyl one of the most dangerous opioids when misused. Percocet. 2 drugs are packed into one pill. One blocks pain, the other strengthens the effect. That pill is Percocet. Percocet combines oxycodone with acetaminophen. Oxycodone is the opioid component, the same type of drug found in OxyContin. Acetaminophen is a common pain reliever used in medications like Tylenol. Oxycodone reduces pain by weakening the signals traveling through the nervous system. As those signals drop, pain feels less intense. Muscles loosen and the body begins to relax. Like other opioids, it also slows the central nervous system. Breathing becomes slower. Alertness drops and the body can feel heavy or drowsy. Acetaminophen works differently. Instead of slowing nerve signals, it reduces the production of chemicals that increase pain and inflammation. This helps lower the overall pain level so the opioid does not need to work as hard. But the combination creates 2 separate risks. Oxycodone can lead to dependence because the brain begins linking the pill with relief. At the same time, acetaminophen must be processed by the liver. High or repeated doses can overwhelm the liver's ability to break it down, leading to serious liver damage even before an opioid overdose occurs. Vicodin. Vicodin is often the prescription that follows a back injury, dental surgery, or a broken bone. It's one of the most commonly prescribed painkillers in medicine. Vicodin combines 2 drugs in a single tablet, hydrocodone and acetaminophen. The goal is to reduce moderate pain while keeping the opioid dose lower. Hydrocodone is the opioid component. It weakens the pain signals traveling through the nervous system before they fully reach the brain. As those signals drop, pain feels less intense. Muscles loosen and the body begins to relax. Like other opioids, hydrocodone also slows the central nervous system. Breathing becomes slower, alertness drops. The body can feel heavy, calm, or drowsy. That relief is what makes the drug effective, but it's also what the brain begins remembering. When the pain fades and the body relaxes, the brain releases dopamine, reinforcing where the relief came from. The second ingredient, acetaminophen, works in a different way. It lowers the production of chemicals that increase pain and inflammation, helping reduce the overall pain level. But acetaminophen must be processed by the liver. Repeated high doses can overwhelm the liver's ability to break it down, leading to serious liver damage even when the opioid itself isn't the main problem. Adderall. Tasks that felt impossible suddenly look manageable. Your thoughts line up, distractions fade, and focusing on one thing becomes easier. That clarity is why Adderall is prescribed. Adderall is a stimulant made from 2-amphetamine salts. Instead of slowing the nervous system like many prescription drugs, it speeds certain parts of it up. The drug increases the release of dopamine and norepinephrine, two chemicals that control attention, motivation, and alertness. As those levels rise, the brain becomes more active. Signals between nerve cells fire faster and stay active longer. The result is stronger focus, increased mental energy, and the ability to stay locked onto a task for longer periods. The body feels the shift too. Heart rate can increase. Blood pressure rises slightly. Sleep becomes harder and appetite often drops. For someone with ADHD, this stimulation can help organize attention and reduce impulsive behavior. But the same dopamine surge also affects the brain's reward system. When focus suddenly improves and tasks feel easier, the brain remembers where that boost came from. Over time, the brain can start expecting the drug to produce that level of focus and energy, which is why stimulants like Adderall can become habit-forming when used outside their intended medical purpose. Vyvanse. At first, nothing really happens. No rush, no sudden burst of energy. Then focus quietly starts locking in. Distractions fade. Tasks that felt scattered begin lining up in your head. That delayed effect is exactly how Vyvanse is designed to work. Vyvanse is a prescription stimulant used to treat ADHD and binge eating disorder. But unlike many stimulants, the drug isn't active when you first take it. Your body has to convert it. After entering the bloodstream, enzymes slowly transform lisdexamfetamine into dextroamphetamine, the stimulant that actually affects the brain. As that happens, the brain releases more dopamine and norepinephrine. These chemicals increase alertness and strengthen attention. Mental energy rises, wakefulness increases, hunger signals become weaker, which is why appetite often drops. Because the drug activates slowly, the stimulant effect builds gradually instead of hitting the brain all at once. But once active, the same dopamine signal that improves focus also reinforces the experience. The brain remembers where that productivity and mental drive came from, which is why repeated misuse can still lead to dependence. Valium. Your muscles loosen, the tension fades. Thoughts slow down enough that your mind finally stops racing. That calming effect is what Valium is prescribed for. Valium, also called diazepam, is a benzodiazepine used to treat anxiety, muscle spasms, seizures, and alcohol withdrawal. Like Xanax, it slows activity in the nervous system. As brain activity drops, the body relaxes. Muscles release. Anxiety softens, and the constant feeling of urgency begins to fade. But Valium behaves differently than Xanax. It stays in the body much longer. Once the drug enters the bloodstream, it can remain active for many hours. The calming effect can last through most of the day and sometimes into the next morning. During that time, the nervous system stays suppressed. Reaction time slows. Coordination becomes weaker. Alertness drops. At higher doses, breathing can slow and thinking becomes noticeably impaired. Because the drug lingers in the body, repeated doses can quietly build up. The brain adjusts to the constant calming signal, and over time, the same dose produces less effect. As tolerance grows, the brain can begin relying on the drug to keep the nervous system from rebounding into anxiety. Klonopin. Panic hits fast, your heart pounds, breathing becomes tight, and your brain suddenly reacts like something terrible is about to happen. Klonopin is often prescribed to stop that spiral. Klonopin, also called clonazepam, belongs to the same benzodiazepine family as Xanax and Valium. These drugs slow activity in the nervous system to calm anxiety and prevent seizures. As the drug takes effect, the nervous system begins to settle. Panic signals weaken, muscles loosen, breathing becomes steadier, and the body shifts away from the intense alert state that drives panic attacks. Klonopin works a little differently than the others. Xanax tends to act quickly and wear off sooner. Valium can stay in the body for a very long time. Klonopin sits in the middle, entering the system steadily and remaining active for many hours. That longer window keeps the nervous system suppressed for extended periods. Alertness drops, reaction time slows. Coordination becomes weaker and thinking can feel dull or slowed. With repeated use, the brain begins adapting to the constant calming signal. The same dose becomes less effective, and stopping the drug suddenly can cause the nervous system to rebound sharply, triggering anxiety, tremors, or seizures as the brain struggles to regain its normal balance. Ambien. You finally fall asleep, but the next morning your kitchen looks like a midnight snack tornado hit it, and you don't remember eating anything. That strange effect is connected to how Ambien works. Ambien, also called Zolpidem, is a prescription sleep medication designed to help people fall asleep quickly. Unlike Xanax, Valium, or Klonopin, it isn't mainly prescribed to calm anxiety. It's meant to switch off the brain's wake signals. The drug slows activity in parts of the brain that keep you alert. As those signals drop, the brain moves towards sleep. Thoughts fade. Awareness lowers. Reaction time slows. Sleep can happen quickly, but Ambien also interferes with the brain's ability to form new memories while the drug is active. That's why some people perform complex behaviors while technically asleep, eating, texting, walking around, or even driving, and have little or no memory of it the next morning. Over time, the brain can start expecting that chemical sleep signal. Without it, falling asleep may become harder as the brain struggles to trigger the process naturally. Now you've seen what these prescription drugs do, and why the same effects that make them useful can also make them addictive. If you enjoyed this breakdown, you'll probably like the next video on your screen.